Okay, good afternoon. Today I'm going to present on the tired athlete. So before starting to present on the tiredness of athlete, the causes and everything, so I'll start with quote as fatigue makes cowards of us all. So it's by Vince Lombardi, NFL coach. So first I'll talk about tiredness. What is tiredness? So it's imbalance between the rest and exercise. What is athlete? Athlete is a skilled person in sports requiring a physical strength, agility and stamina. So what is the causes of tiredness in athlete? So there is few here: common non-medical causes and common medical causes, and also less common, and also few other causes. So the first one I'll talk about common non-medical causes. First thing is suboptimal sleep, social factors, lifestyle factors, overtraining. So today I'll be talking more on overtraining and inadequate carbohydrate intake, timing of carbohydrate intake with inadequate protein intake, with inadequate hydration and also iron deficiency. If common medical, usually viral illness, respiratory symptoms, psychological, depression or anxiety, medication, alcohol, caffeine, endocrine like PCOS or insulin resistance. So if less common is hypothyroidism, DM, chronic fatigue syndrome and malabsorption with eating disorder. So other things that we couldn't miss is malignancy, cardiac failure, adrenal disease and liver disease with infections, with neuromuscular disorders, inflammatory bowel disease and pregnancy with post-concussive syndrome. So how to approach a tired athlete? First, of course we start with history taking. So history taking, what we want to ask them first. So how long the athlete has been tired? So are there any particular trigger that makes them tired? Any pattern of tiredness, whether it's constant or only post exercise, and any at certain venues or certain season or certain conditions. Has there been any past history of getting tired before this? So how tired is the athlete? And we need to know the history of medications, patient taking caffeine, alcohol, supplements, tobacco and drugs. So other than that, we need to ask them on the training diaries. So the session, the types, volume, intensity, time of day, the duration of time, number, timing and duration of competitions, recovery time and the practices. Any baseline performance values to compare with actually. So then next we need to ask on the sleep history. How is the sleeping time and waking time? Is it disturbed? Duration of sleep, quality of sleep. So usually log on a activity tracker to log on this. And any suggestion of sleep apnea or snoring, or athlete's routine prior to the bed. Okay, so the next one we can ask on nutrition diary, food diary for 3 to 7 days. So we can ask on the symptoms of medical conditions to rule out all the medical causes. So respiratory, infective respiratory symptoms, GI symptoms, cardiac symptoms, rheumato, neurologic, endocrine. And okay, so other psychosocial stresses that we can ask as well, the relationship with the coach, how's the relationship with the coach, and at school how is he, work or at travel. So psychologically, how's the mood, depression, anxiety, performance anxiety, eating disorder. So and also the performance concerns, any upcoming selection or competition or any coach or team issues. So tool to assess on the fatigue or stress or exertion is using this few questionnaires. The first one is POMS, profile of mood stress. The second one is iceberg profile, and the third one is rescue spot. So it's a recovery stress questionnaire specific to the sport, and RP is a box scale. So there's physical examination. So first we from history taking, we need to know whether this patient is having a medical causes or non-medical causes. So based on that, try to tackle on that physical exam medical causes. So if let's say medical causes, what are the tendency a patient having tiredness, so maybe can have jaundice, pallor, so it can indicate liver disease or anemia, or otherwise if the patient is having infection or asthma, can relate to respiratory disease, or cardiac, check on the murmurs or bruit, and abdomen wise the organomegaly lah. So the anthropometry wise, the BMI, the fat percentage, and the waist girth lah. So and then also the endocrine wise, you need to know whether pubertal stage assessment, amenorrhea or oligomenorrhea lah. So then we check for other thing as well as signs of purging, and also for thyroid, check for goiter or oily skin or loss of outer third of eyebrows lah. So then the next, after physical examination, we proceed for investigation. So we cannot carry out all the investigation, so unless it's indicated. So sort out the causes first. So if simple explanation for the tiredness, the short trial of treatment is indicated lah. So if let's say he or she is recovered, so the diagnosis likely to be confirmed lah. So there's a common non-medical causes of athlete tiredness, which is non-functional overreaching and overtraining syndrome. So before talking on the non-functional overreaching and overtraining syndrome, I like to brief on that functional overreaching lah. So functional overreaching is increased training leading to a temporary performance decrement, and it will be improved performance after the rest. So this is functional overreaching. So the difference between the functional and non-functional is the performance outcome lah. So if let's say you see the non-functional overreaching is intense training leading to a longer performance decrement. So if functional overreaching will take up to days, if non-functional, the performance decrement might take 2 weeks, like that. Okay, and is accompanied by increased psychologic and or neuroendocrinologic symptoms. The overtraining syndrome means consistent with extreme non-functional overreaching. So it's the extreme of non-functional overreaching. So with longer performance decrement, which is more than 2 months, and more severe symptoms and maladapted physiology. So including the psychologic, neurologic, endocrinologic, immunologic. So accompanied by an additional stressor beyond the excessive training load now, or not explained by the other disease. So which is that if we see the overtraining, the performance decrement might take up to months lah if overtraining. And what differs the non-functional overreaching and overtraining is the amount of time needed for the performance restoration lah. So the detrimental effect of this overtraining syndrome, I divided into 5 here. Okay, so the first one, the psychologic wise, he can have insomnia, anhedonia, mood disturbance, increase in fatigue. So if you see in physiological, bradycardia, tachycardia, so all the autonomic nervous system responses lah, hypertension, restlessness. And biochemical wise, the glycogen depletion, glycogenolysis, the catabolism will be increased, and you can have increased CK as well. And hormonal and neurological wise, there will be delayed menarche, oligomenorrhea, amenorrhea, hypothalamic pituitary adrenal hormonal axis maladaptation. And if you see immune, there will be reduced mucosal immunity lah. So you can have more URTIs bought. And so diagnostic tool, like I said, like just now I mentioned, was POMS, profile of mood state, TDS, training of distress scale, rescue spot, and the psychomotor speed test, which is using the test of reaction time and the alteration. So the next one for this treatment will be rest lah actually. So how to want to prevent on this overtraining syndrome is basically focus on executing appropriate recovery in training program. So which means in a week you give a day off like that. Then second one, regular performance tests And third one, close relationship between the athlete, coach and doctor and sport medicine team to monitor on the warning signs and alter the training according to the stresses. So the fourth one measures some simple psychological markers, which is the weight, morning heart rate, maximal heart rate and heart rate variability. And the last one is alteration on the recovery contributing factors lah, which is the mood state monitoring or nutrition and sleep. That's all.